What are the microscopic differences of squamous cell carcinoma? Imagine peering into a tiny world where cancer cells tell a story through their shape, size, and behavior. Squamous cell carcinoma is a common skin cancer that originates from the flat, scale-like cells called squamous cells. Under the microscope, it reveals a variety of features that help doctors identify its subtype and understand how aggressive it might be. Typically, squamous cell carcinoma shows nests or sheets of abnormal squamous cells that extend from the outer skin layer into the deeper layers of the skin called the dermis. These malignant cells are usually larger than normal skin cells, with abundant pink-staining cytoplasm, which is called eosinophilic. Their nuclei are often large and may look vesicular, meaning they have a clear or hollow appearance. One hallmark feature is keratinization, where the tumor cells produce keratin, a protein found in skin-forming structures known as keratin pearls. These are round, layered collections of keratin that look like small, shiny beads under the microscope. Another important feature is intercellular bridges, which are connections between neighboring squamous cells. These bridges are a sign of squamous differentiation. The cells often show pleomorphism, meaning they vary in size and shape, indicating abnormal growth. Increased mitotic activity or rapid cell division is also common, showing that the tumor is actively growing. Different types of squamous cell carcinoma have unique microscopic features. For example, conventional or keratinizing squamous cell carcinoma displays well-formed keratin pearls and prominent intercellular bridges. The tumor cells look like normal squamous cells but with abnormal features. In contrast, squamous cell carcinoma in situ, also called Bowen disease, is confined to the outer skin layer and does not invade deeper tissues. Under the microscope, it shows full-thickness atypia of keratinocytes, with abnormal cells throughout the entire epidermis but with the basal layer still intact. Sometimes, this pattern is called the eyeliner sign because of the clear boundary at the bottom. Acantholytic or subductal squamous cell carcinoma is another subtype. It features loss of cohesion between tumor cells, leading to spaces that resemble glands. These spaces are created by acantholysis or the breakdown of cell connections, giving a gland-like appearance. Clefting around tumor nests is also common. Spindle cell or succumbed squamous cell carcinoma is characterized by tumor cells that are elongated and spindle-shaped, resembling mesenchymal or connective tissue cells. These tumors may lack the typical keratinization and intercellular bridges, making diagnosis more challenging. Immunohistochemical staining often helps confirm their squamous origin. Clear cell squamous cell carcinoma contains cells with clear cytoplasm, which results from glycogen buildup or swelling. Sometimes, these cells look like signet ring cells because of large vacuoles pushing the nucleus to the side. Verrucous carcinoma is a well-differentiated variant that appears as a warty or papillomatous growth. Microscopically, it shows broad, pushing borders rather than infiltrative growth and minimal atypia. Despite its benign appearance, it can be locally aggressive. Other variants include basalid squamous cell carcinoma, which has small, dark basalid cells, and lymphoepithelial carcinoma, which contains a dense lymphoid infiltrate. Each subtype has distinct cellular features and growth patterns but all share squamous differentiation. The grading of squamous cell carcinoma depends on how closely the tumor cells resemble normal squamous cells. Well-differentiated tumors show prominent keratin pearls and organized cell structures. Poorly differentiated tumors lack keratinization, have high cellular atypia, and show increased mitotic figures, indicating more aggressive behavior. Understanding these microscopic differences is crucial for accurate diagnosis and treatment planning. Certain subtypes like spindle cell or acantholytic squamous cell carcinoma may have a worse prognosis and need more careful management. Detecting squamous cell carcinoma early, especially in its in situ stage, can prevent invasion and help preserve healthy skin. In summary, The microscopic features of squamous cell carcinoma reveal a spectrum of cellular shapes, keratin production, cell cohesion, and growth patterns. These details help pathologists distinguish between subtypes and guide clinicians in choosing the best approach to treatment. Always remember, if you notice any suspicious skin changes, consult a healthcare professional for proper evaluation.